Rand Paul went on Greta Van Sustren's show on Fox News, and he laid out his healthcare plan. This is hilarious. Let's watch.
All right, so why is there not gridlock? Let's take as a hypothetical that you vote in the House and the Senate, because Republicans will own both as of tomorrow, that you vote to repeal Obamacare, something that the Republicans want to do. It then goes up to the president. He vetoes it. Now we're at a standstill again.
Unless we come back and say, well, now we're going to repeal part of Obamacare, are you going to veto that too? So I think there'll be votes on total repeal. They may or may not succeed. There'll also be votes on partial repeal. There'll be votes on things we really want and maybe he won't agree to. But the only way you can figure out what the compromise is, you have to have votes. If you never have votes and one side just puts up what they want and nothing else, then nothing ever gets accomplished. So I think by putting bills forward, you're going to find out what the president will veto and what he won't and what the middle ground is.
All right, suppose that you vote to repeal Obamacare, and let's say hypothetically, and I don't think it's going to happen, but the president were to go along with you and repeal Obamacare. What in the world would happen? I mean, where would we? I mean, what would happen to the American people? What would they have or not have?
We could try freedom.
We could try freedom. Look, on many issues, I agree with libertarians. In fact, we have a lot of libertarians that listen to the show. On like 40 or 50% of the issues, I agree with them. And this idea of freedom is a fantastic idea, especially when you're talking about in the realm of social issues and what you do to your own body, what you do with your own body. You want to put whatever drug in your body, be my guest, go right ahead. I'm not coming to stop you. If you're a woman who's making a decision about an abortion, it's your decision. I don't want the government getting involved in any way, shape, or form. I mean, there are a plethora of issues where we can agree with libertarians and we can say, yeah, on personal issues, social issues, freedom's the key, man. But when you start using a slogan or a single word to describe your policy position for something as complex and nuanced and big as a healthcare system or an economic system, and you just say, freedom, man. No, at that point, you went from generally supporting something that makes sense to making absolutely no sense and showing an ignorance of how the system really functions and how it really works. So I'm with you on social issues. Freedom, man. But when it comes to economics, when it comes to healthcare, one word doesn't suffice because there's a lot more that goes into determining how to run an economic system, how to run a healthcare system. And what this reminds me of is what Rand Paul's dad said in the Republican debates. Do you guys remember this?
Let me ask you this hypothetical question. A healthy 30-year-old young man has a good job, makes a good living, but decides, you know what, I'm not going to spend $200 or $300 a month for health insurance because I'm healthy, I don't need it. But, you know, something terrible happens, all of a sudden he needs it. Who's going to pay for if he goes into a coma, for example? Who pays for that?
In a society that you accept welfareism and socialism, he expects the government to take care of him.
What do you want?
But what he should do is whatever he wants to do and assume responsibility for himself. My advice to him would have a major medical policy, but not before.
But he doesn't have that. He doesn't have it, and he needs intensive care for 6 months. Who pays?
That's what freedom is all about, taking your own risk. This whole idea that you have to prepare and take care of everybody.
But, Congressman, are you saying the society should just let him die?
No. I practiced medicine before we had Medicaid in the early 1960s when I got out of medical school. I practiced at Santa Rosa Hospital in San Antonio, and the churches took care of him.
The church money wouldn't be enough. It won't cover it. Charity is not enough. It won't cover it. You know how I know this? We had that system, Ron. We had the system you're advocating for, and it was a disaster. I mean, just right before Obamacare, it was like the wild, wild west in terms of healthcare in America. We did have Medicaid and we did have Medicare, and we did have the VA. But when it comes to somebody who's a middle-aged person who's working a job, them going to the private market and buying insurance and basically having a capitalist healthcare system set up, it was a disaster. And it's not my opinion that it's a disaster. We know when we compare the numbers and the statistics and the facts to other modern nations, we know that we were worse off in America. 45,000 people died every year in America because they didn't have access to basic healthcare. That's under the system that Ron Paul prefers. 47 million were uninsured. So again, this utopia idea that, if you just give everybody freedom, it'll all work out in the end. Or not. Or there are certain things that in a civilized society, they should be off the table. That if you're making a list of, hey, if we have a government, what should it take care of? Some things should be on the top of the list, like healthcare. And also, they make it seem like the cost would be better, the quality of care would be better. Wrong. Because when you look at the numbers, American healthcare is most expensive and we get worse outcomes. So he doesn't know what he's talking about on this issue. And isn't it scary to hear the response from the members in the crowd? When Wolf Blitzer is like, well, what do you want to do? I just gave you the hypothetical. A young kid doesn't have health care. He gets into a car accident. He's in a coma or he's unconscious. What do you want to do? What do you want to do in that situation? You want to let him die? Some people in the audience went, yes! Well, there you have it, man. When you talk about far-right extremists, they have this mentality of there's no such thing as a community, there's no such thing as a society, there's no such thing as a social contract. It's just me, and I make my own decisions, and you make your own decisions, and if you're in a bad situation, fuck off, I don't give a shit. Now, what's always hilarious about these people is that the second they are put in a situation like that, they're the first ones to say, what do you mean you have to help me? This is crazy. You're not going to help me? The government should help me in this situation. What are you talking about? Ayn Rand, who argued against Medicare, argued against Social Security. She took these government services. So spare me. There are certain things, living in this anarcho-capitalist society and acting like the answer is always the free market, that's pseudo-religious. That's ideology above all else. You need to care more about empiricism than theory. I'll repeat that. You need to care more about empiricism than theory. So in other words, you have an idea, you think it might work, this idea of totally free market healthcare. Great, but then after we implement it and we see that it doesn't work, that the statistics and the facts show it's not better than public healthcare systems overseas, if you want to call yourself a rational person, you have to change with the evidence and admit when you're wrong. Libertarians on this issue are not willing to do that.